more. I'd like to be Robert Scoble, and I deal mostly in the wearable space, specifically facilitating vision and acuity for smart devices.
Cool. Doctor.
Daniel Kraft. I'm a physician, trained in internal medicine, pediatrics, and then hematology, oncology. Got involved in medical devices and the convergence of technology, partly through my role chairing the medicine track at Singularity University and running a conference every year called Exponential Medicine, which looks at the convergence of technologies from wearables to big data to genomics, and looking at how we can rethink and reinvent healthcare through emerging technologies, including in digital health.
So my job is to keep these guys short and succinct. And what I want to do this morning is talk about what's out there. You walk the floor, you read the literature, there's a lot of stuff out there. And I wanted to define it around a really quick, simple question. Hot or not? Is it hot? Is it not? And I'm going to force these guys to answer questions on a scale of 1 to 10. So they have to give me a number. 1 is not hot, 10 is hot. And we're going to try to dissect it a little bit. So quick answers and try to put things in perspective as you move forward with the sessions today to help you put things in context a little bit. So, okay, you didn't know I was going to ask this. So CES, this meeting in the context of digital health. Robert, 1 to 10.
The last 4 have been between 6 and 7. We haven't seen a lot of news here, but everybody's here. So we all have to
give me a number.
8 this time.
8, good. Tim?
I'm going to say it's a 9. It's good to see the crowds are back, finally.
I'd say it's maybe 6 going to 8. From the consumer perspective, it's consumer wearables. The trick is blending in the physicians, the payers, the pharma world to start using these in actionable ways.
So is CES emerging as sort of an epicenter for the digital health movement? Again, I want to focus on that.
Yeah, I think you're seeing, there's over at the Cosmo, there's an App Nation. So you're seeing new kinds of app developers here for the first time. And same thing is happening here at the Health Summit. We're seeing a lot of innovation in health. And obviously there's a lot of interest in this space because the seats are filled.
So is CES becoming not consumer but clinical in a way?
Well, I think the interesting thing, looking at the exponentials from Moore's Law and all these things that are shrinking, are starting to be applied to all these pain points in health and medicine, whether it's our personal health, diagnostics, therapeutics, public health. All of that is now sort of being reinvented through this magical world where now a computer's on your wrist, and that's starting to become relevant to not just tracking your vital signs, but your emotional state in context and beyond. So it's becoming more relevant, and again, it's where you mash it up with the unmet need that makes the most sense.
You know, we all talk about empowerment of the patient and the empowerment of the consumer. So I guess the consumer electronics show is relevant. That word, that consumer, is a driver. So as some of you may know, I have a love-hate relationship with wearables, and I think we all do to a certain degree. So I want to jump right into that idea of wearables.
We were talking about, hey,
yeah.
I'm not wearing, John, last year you had like 15 wearables.
No, he did.
I like today just 1.
So give me a number. Let's do it. You know, this idea of wearables. I'm not going to name brand names here, but I think the idea of this tracker dynamic. Numbers first. Daniel.
I'd say it's gone from about a 4 to a 7, given the fact that these are now going beyond just being your steps and maybe your sleep.
Let's do the numbers first. Tim.
I'm going to say it's you can see it on the floor, it's obviously a 10 to consumers. I think benefits and uses, I would give it a different number.
Yeah, I agree.
What number?
Consumer interest is very high. But the actual utility of the
so you go 9 or 10. So let me ask you a question.
I would say
I think it's 2 categories.
Yeah, it's hard to answer these questions.
Need to be an 8 or 9 or a 10 as a marketing construct to drive consumer interest, or is it really an interest?
Remember when the Apple II came out, Steve Wozniak's boss thought nobody would ever buy a personal computer. And I think we are seeing these same kinds of hype and anti-hype cycles because sometimes we talk about the future too much and the products aren't here yet. We all know this is going in a real important direction. If we come back 10 years from now, this is going to be something that saves lives, affects our outlook on health. But we're in like the Apple One days right now. Apple II, I mean, the watches we've seen are the rudimentary. They're going to look very rudimentary 10 years from now.
So give me, I want numbers now. Start with a number. Telemedicine.
Telemedicine is on the upswing. I'd say it's about a 6.
6, interesting.
But I want to come back to this number thing on the wearable side. It's a bit of a so what. It's maybe consumers. We're all patients and consumers. It's becoming more relevant now, but for the physician, the clinician, it's still maybe a 2 or 3 because no physician can, in general, access your Fitbit data. It's starting to now blend through Apple Health Kit and others through into your electronic medical record. Then it starts to become very relevant and start to guide therapy and diagnostics.
So you can take Scout out later if we have some time. Take Scout out later. I just want to get through some of things. All right, so telemedicine?
Again, emerging, 6. There's like 5 new companies that have popped up in the last year, and you can now download an app and talk to a doc on your phone for $20.
Tim?
I hate the waiting room. I hate it. So I'm going to put it also, I think it's got movement, but before we would come back, it'll be at a 9, but I would say it's in the 7 area.
Robert?
Yeah. It depends where you are in the world. If you're in a place that doesn't have a good medical system, telemedicine could possibly save your life or improve the care of your life.
I have a great medical system, but at 3 o'clock in the morning when my kid's got an earache, I'm not so inclined to go through that. So give me a number.
A 6 and getting more important.
All right, so it's moving in the right direction. The interesting thing, I think there's a connection between devices and trackers and telemedicine because they'll come together. And I think as they come together, that might be an interesting dynamic.
Well, we've been doing telemedicine for years. We have telephones. That's how we do a lot of medical consults. But now that's starting to blend with, the Skype on your phone, expanding to not just the communication between the patient and clinician, but now with devices at home, whether it's your wearables or devices like the medical tricorder Standard Scout, which can pick up your temperature, your heart rate, your blood pressure. All those things start to blend with the actionable data coming to you and your clinician.
Does it have a crappy name? I think, telemedicine, telemarketing. It just, it seems like yesterday's news. I don't know. Does it suffer from an identity crisis?
Connected health, emergent health.
Maybe.
I look at it deeper than, I don't call it telemedicine. I mean, what is Health Tap doing by connecting doctors and patients together and so that you don't have to visit the hospitals?
Who's used telemedicine?
I've used Health Tap. So that's
so you guys have used it. I've used it in Dublin, coming back from Health XL, and you are now
signed up to be a doc on one of those. I've appeared in places on a telepresent robot like the Beam. So again, I think when you think about telemedicine, it's usually thinking about a sort of a Skype-like session where it's going to merge is with the data from your home, your genomics.
All right, let's move on. Let's go to nanotechnology, and I know it means different things to some of you, but Daniel, nanotechnology
is a buzzword still. It's about a 6.
6. How do you define nanotechnology?
Well, it's anything super small, but it's mostly blending the world of digital devices melding with pharma, so you can design a drug that matches you, or track a cancer, or meld with even your wearable type information. So it's a broad term.
A lesson to learn for everybody is that language is important. The words we say have to be put into context. Tim, tell me about nanotechnology in your worldview.
It's not really that important because everything has to get smaller, it has to get cheaper. Battery, all the component pieces have to get more elegantly small and invisible. So I think that's a natural evolution, but nanotechnology, I don't think I'd use that. So
very different interpretations. Robert, real quick, and then I want to move on.
It's like asking, is this glass of water hot, interesting to people? Well, if everybody has a glass of water and we're not thirsty, it's not a big deal. But if there's only one bottle of water left in the world, this bottle is going to be worth more than anything in the world, right? And nanotechnology is inside our car, inside our watches, inside our new Alpine headphones that I have up here. I mean, it's like water.
But when nanotechnology gets inside our body, will it be a game changer?
I think so.
Well, it's starting to. Even Google's now making some sort of nanobots for diagnostics. I think the meta theme on the Exponential is things are getting smaller, cheaper, faster, more integrated. Yeah. And so when you're thinking about digital health, I think it more of the blending of all these elements. Often it's not reinventing anything. I like to say, who's going to build the Uber of healthcare or this Uberification? It's the fact that things are now getting mobile and connected and giving you insight and transparency.
It's sort of like if we were at the launch of the Apple II and we're going to argue for an hour about whether anybody's going to buy a personal computer. I hate looking at the world this way because I'm seeing inside the R&D labs, and we all know this industry is happening and it's coming at us. It's not here yet, and that's the frustration that we're sort of
Waiting out.
Waiting out, right? The Apple Watch is coming this year, but it's gonna suck. But it'll sell 15 million copies, right?
All right, so here's something that I'm seeing a lot of, and I want to kind of help put that in a context from both social, practical, residential, as well as clinical. 3D printing. Give me a number first.
I'd say 8.
Tim?
10.
Robert?
9 to 9.
Well, so that's a winner. I think that's one of the highest.
For sure.
Let's break that down a little bit from a clinical perspective.
So for
Dan.
lots of interesting experiments, I've actually got a 3D printed version of me as mini-me in my pocket, just with the Microsoft Kinect in it.
The interesting thing, it's almost the exact size as Daniel.
Yeah,
as the mini-me.
better looking. But the interesting thing, 3D printing is getting applied in healthcare in many interesting ways, from your braces, like Invisalign, that's been around for a while, to 3D printing stents that are emerging for cardiac disease.
We just saw a prosthetic, right?
Yep, prosthetics that are matching your missing leg, for example. So this long tail, this idea of 3D printing is coming everything to the orthopedic realm, to cardiac realm, to earpieces that match your ear. So
printing is bringing us organs soon.
So yeah, my field is stem cell biology. We're at the early stage of starting to replace ink with stem cells and progenitor cells to design your organ from your own personal stem cell line. So it's moving quickly, and 3D printing is a pretty broad term along that realm.
So I think that one of our observations today is, when we want to know what's hot, what's not, is what's relevant in our marketplace, what are some of our business objectives in terms of finding opportunities as marketers, as entrepreneurs. So 3D printing seems to be gaining some traction. Where do you take it outside of clinical medicine? You have it residential 3D printing. And we have made in space now, where they're printing hammers at the shuttle, or wrenches.
First 3D printer on the space station, they can now print a medical device. It's hard to get supplies there, whether you're in Haiti and you need a clamp for a kid who's born, that's now been printed, all the way to the space station wanting a medical device. The ability to design, create, modify is very powerful and has a lot of medical applications.
So are we going to have a 3D printer in our kitchen soon?
I think Robert already does, but we're doing 3D printing for medical devices, for frames, specialty frames for surgeons, whether they're using some type of wearable or whatever it is, a device that they want some kind of special contraption. We just design it, print it, and ship it. It's done all in our R&D, and I think that's, in the R&D world, you see that this is just a tool like it is a phone or a monitor. It's not, will it? It already is. The evolution of it will continue to grow out into more practical ways.
Yeah.
So what do you say?
I was just remembering when Bree Pettis gave me a tour. He runs MakerBot, started MakerBot, and that was, I think, 4 years ago. So is it hot? Yeah, it was new back then. Now it's becoming mature and more mature. The printers are working better. I mean, they're printing chocolate now, right? I mean, there's all sorts of new things coming that are affecting the world in a real way.
But the application to digital health seems to be real and significant, and really
you're seeing stories every day.
A foothold.
You're seeing stories every day of people printing new things with a 3D printer that help people live their lives.
How many people in the audience have a 3D printer? Anybody?
Just one.
2, a handful. I think that's kind of interesting.
It is very interesting because 3D printing has been around at CES for 4 years now, and we still don't own one at home. It's still too geeky, too nerdy, expensive, and people are still struggling to see the utility of it. The leading edge people are seeing a lot of utility.
It's coming into medical education. You can print the heart that you're going to operate on, or enable someone to learn about the anatomy. I know someone who's got Crohn's disease. He's printed his own colon. Gives you different perspectives on
I want to talk a little bit about this idea of visual medicine, of being able to see things, to be able to have a handheld stethoscope, being able to just visualize using, the visual cortex is a large proportion of our processing in our brain. And I'm curious, is that notion of visualization on our trend scale somewhere? What would you?
Well, I think we're seeing, particularly at CES, this blend now of augmented reality, the Oculus world, blending with the Google Glasses
Give me a number
world.
on that.
I think it's about a 6, but moving quickly, both for medical education, for training, for the physician to get to visualize the tumor inside the surgical field.
Yeah. Tim, you can't go to 11, but give me your number.
Well, I'm not going to say any particular devices, but it's a 10 for me.
Yeah.
Because of exactly what Doc's saying, is that the uses are, it's just an open runway what we could do. It's going to take us some time.
Yeah.
But, you know, I just recently lost 2 very close friends in the last week. And it's been a big sting to me. So I'm very about life and anything that's going to help us, anything, I don't care what it is, that's going to help us have a happier life, help our friends live, save our parents.
So am I going to have a
critical
pocket? Am I going to
things.
have a pocket ultrasound in my lab coat pocket now, and I'm going to throw away my EKG, my stethoscope rather?
Oh, they already exist. So I mean, your smartphone is connected to an ultrasound, the Scanner-Do type tricorders. The idea of a digital doctor's bag. We're thinking about all these convergent technologies. The clinician, you know, where medicine happens used to be in the hospital, in the clinic. Now it can come into your home, and your physician can come to your home now with a digital doctor's bag and have essentially an ICU level of.
The Scanner-Do, I mean, show people the Scanner-Do again. This is a little device that John was showing me outside. He puts it on his temple, and it shows him his heart rate and his.
So let that acquire while you're
stuff.
talking.
Right. But the problem is we don't yet have real good visualizations of what that data means. An average consumer doesn't know what blood pressure means. You guys do.
Right, so this will track my blood pressure, my heart rate, my temperature. Now what's interesting about this point is lots of data from our wearables and beyond is just data. The trick we need is to make this actionable and to ourselves, not just data, but information. And as I see my trends, your normal temperature and blood pressure is different than mine. If you can, this can start to learn you, and this is kind of integrates your temperatures and beyond, and blends with artificial intelligence. We're going to learn you. The patient will have, the consumer at home, the ability to do triage in a much more smart, effective way.
No matter where you are in the world, a stop sign looks like a stop sign. And I'm curious if clinical indices can be formalized in a visual perspective so that I know that LVEDP always looks like an upside down triangle or something. Just a way of sort of moving forward with visual medicine. Okay, the genie is out of the bottle, ladies and gentlemen. Elon Musk has given us a terrible warning. Let's talk about AI in the context of digital medicine. Give me a number first, Robert.
It's funny because I was sitting with the CEO.
He's not going to give me a number.
No, I was sitting with the CEO of Palantir, who builds the system that the NSA uses to search for us. And we were having this argument about, is it going to kill, is artificial intelligence going to take over our world? And Steve Jurvetson says, actually, it's just going to make us its pet.
Okay.
So, but artificial intelligence, I'd say 10 going to 50. I mean, it's really the centerpiece of a lot of new products.
Let's go around. Tim?
I'd say it's a 10. It frightens me because there's a lot we don't and won't know.
We're heading into a world where we're going to always be surveilled.
Well, and I think we have to. The faster we wrap our minds around that, the faster these things.
One of my favorite AI quotes is yours, and it's not AI, but the other way. So
I thought IA instead of AI, intelligence augmentation. So for the poor doctor out there who now has a panel of 1,000 patients, each wearing digital devices, they don't want to look at your heart rate, your EKG, your blood pressure. We need to integrate that information, and technologies like AI are going to start to blend this. I like to call it predictalytics. Where's you or your patient's trend heading before the heart attack, the stroke, or the cancer becomes detectable? And so we need, as individuals, with all this massive exponential data sets, to make sense of it. And that's where AI is playing a role with things like IBM Watson and others, so that it becomes part of the workflow of the physician. It may be malpractice in a few years that your physician has not used an AI system to help make the diagnosis or pick the right therapy. And on this fast trend with billions of data points coming from our digital exhaust, we're going to need that to make sense of all the omics.
That's very interesting. Someone said that today, if they asked you to get in a driverless car, you'd be worried sick. Oh my God. 10 years from now, you'll question why a human would ever be allowed to drive a dangerous vehicle like a car. So I think that complete switch, does that make sense to you guys? Is that AI will really emerge as a preeminent sort of aspect of cognition and guiding clinical judgment?
It already is. I mean, Facebook, for me, is a real competitive advantage. It's run by AI, right? It's choosing what messages to show me. If you didn't know, you're not seeing every message on the feed, right? It only shows you the good ones. And the good ones
so that's our top. That's pretty much a 10. Interesting things going on. Genomics. Let's start with you, Daniel. I think that's probably a very rich area to talk about.
Well, it's not just genomics, it's all these omics, from your exposome, where you lived, your microbiome, the fact that we're now at the point with companies like Ubiome able to sequence your microbiome that plays a role in everything from diabetes to cardiac disease to psychiatry. It's exploding to the point where now we're at a $1,000 genome, in a year or so we'll be at a $100 genome, let's say. Now, it's one thing to have your 23andMe data, it's one thing to have your entire genome plus your exposome and beyond. Where that becomes relevant is when you're a clinician and you can see that data and have a bit of like your Google Now for your health. It's going to start giving you, again, that predictalytic GPS for your healthcare based on your actual data, and not just your genomics, but your proteomics, your
So the number you would give it would be 60 million, right?
I think it's about a 6 today. It needs to, though, integrate in the, for example, the physician workflow. All this digital health is a bit of a so what, for the doctor at least, unless it works into your electronic medical record, the flow, and the overworked physician today doesn't even integrate genomics when it's available.
So my $60 million reference was to Genentech and 23andMe. Do you have any insights into what's going on with that? Or?
Well, I think personal genetics is now blending with research. One of the big levers of digital health is the ability to crowdsource and do clinical trials and research. The fact that we could all donate our data, our microbiome, our genomics. 23andMe is sharing some of their user data with Genentech, which can potentially use that to pick better drugs and selectivity. So as we all get sequenced in the next decade, we can all become data donors and all become part of speeding up digital health.
I think that's one of our quotes for the day, is data donors. How interesting, in looking at clinical trials and the ability to access the appropriate patient type. So what would you give it as a number?
It's still about a 7 because it's not being used yet.
All right, we're going to wrap up. Tim and around. Let's
Yeah,
talk
I'm just
about
going to go with
genomics.
the doc.
Yeah, 7, Robert?
Ditto.
Yep.
Cybersecurity. Where's that kind of loom in today's world in the context of all the things we've talked about?
That's incredibly important. We're all overwhelmed with like HIPAA laws, which is still sort of antiquated. I think we all want to become data donors, but we want our healthcare secure in different realms. But a lot of us would be willing to share our Facebook data, and they've done work in healthcare, our omics and beyond, if it can help us or our friends. And I like to use the analogy of something like Google Maps. When we drive, we share our location, our speed. That's a bit of our privacy, but we get some information back, like the map of the traffic and how to reroute ourselves. When we can all share some of our data and get actual information back, we're going to be more likely to share it, yet we still need to be on top of it. And just because our credit cards get hacked doesn't mean we stop using credit cards. Right. So while we need to be careful about this, we need to still unleash some of this amazing data through our digital and other realms to improve our personal.
Another high score.
Personally, I live in fear of being hacked every day. It could really disrupt what my entire world is. At Rackspace, we care deeply about security and spend a lot of money in it because we have hundreds of thousands of people built on top of us, right? Somebody can get in.
So it's a high score across the board.
High score, but it's not one of those things that makes you feel good. It's one of those things in life that you have to do because you have to do it. Otherwise, you're going to be Sony.
So we look at the retail market now and big box stores versus Amazon and using drones and printing and delivering. What's the brick and mortar physician office and hospital today? Hot or not? What's a 10? Daniel, let's go around, then we're going to wrap it up.
The physician office today still pretty much looks like the one of 10 or 50 years ago, but we're starting to blend these, and there's new disruptive companies, One Medical, new insurance companies, starting to blend the digital realm to incentivize behavior change. We spend most of our dollars on the folks after they get chronically ill or acutely ill, most of which can be melded through prevention. So a lot of the digital health space today is the consumer type wearable, which gives you insights into how unhealthy you're being.
Is it movement away from the brick and mortar
facility? So it's going to be moving away through telemedicine, through...
So give me a number.
It's still about a 6, but in 5 years it'll be a 9.
Wow.
So the movement away, so the brick and mortar is the other way around. So it's 2-3, right? The traditional facility, the doctor's office.
We're going to see a bit of this Uberification of healthcare, where you're going to be access your medical care with insight, feedback loops.
Tim?
I'm going to say not. I detest going into the doctor. I detest it. I don't like the staff. I don't like the way that things run. I don't like waiting all that long. I can't use my cell phone. Well, I do, but I'm not supposed to. And so I just detest that whole experience. It needs to really
So Robert, let's talk about the retail model and how that retail model may be shifting to a more online dynamic and how that relates to clinical medicine and all the things we talked about.
Well, I'm not in the health space. Yep. I'm just studying where the companies are coming. Lively, for instance, has already saved a couple lives by putting sensors on your senior parents' refrigerator, pill bottle, a door. Yeah, I don't know where to go with that.
All right, we're going to wrap it up. I just want to frame up this idea of digital health. Now, don't beat me up on the definition of digital health. I think we're all in this room for this idea of digital health. Hot or not in that grand scheme, let's go around and do the numbers and some final comments. So, digital health.
Digital health is about at a 7. But it's moving into the mainstream of healthcare now as the incentive shift for the payers, the insurance companies, for the physicians, for the pharma world, biotech world. And I think all of us here need to look at this convergence play, not just at the pure digital, but from the device element, the AI element, the nanotech element. At Singularity University and Exponential Medicine, we're looking at where these things start to converge. And as you're building new platforms and solutions, don't build for 2015, build for 2018.
So there's you see the convergence when we talk about that.
As the incentives shift, now there's many different healthcare systems, and the incentives are mostly misaligned in healthcare today. But because these technologies are getting so cheap and ubiquitous, and you can have healthcare system on your watch, it's moving quickly.
How soon are we going to see employers force us to wear something?
Cleveland Clinic, right now.
Employees let the pilots who fly the president have to wear a sleep monitor, right?
Right. So
Tim,
I think
let's score it 1 to 10.
I would say an 8, 9. And look here, you can see standing room only. We moved the event, still standing room only. Everyone wants it. It's going to take us a little time, but hot topic, and it will remain one.
So Robert, when you look at the world and you talk about all these different elements of innovation and technology, and you kind of cherry pick what you're looking at, when digital health comes on your radar, is it an afterthought? Is it top of mind? Where's it going? What's the number 1 to 10? And I'll let you do the concluding comments.
I think it's coming. We all know, I just visited Samsung in Korea and met the guys who are building the sensors that are coming out next year that'll be watching your health. They're very competitive with Apple. Apple has a watch that's going to watch your skin color, so it's going to know your heart rate and maybe glucose. We don't know what that sensor really is going to do. We'll see in March when we finally get it. But there's all sorts of sensor development. An Israeli company came to my suite last night called computer physics. They have a little sensor called SIO that you point at a pill and it tells you what brand of pill it is. It tells you whether it's authentic or not, et cetera, et cetera.
So when you're looking at the driverless car and big screen TVs and all sorts of cool stuff, does digital health get you excited? Is it something that's gonna be
if you
important?
take a 10-year view on it. Same thing with self-driving car. I know the guy at BMW who's building that stuff, and I know David Hall who built this LiDAR that's on top of the Google self-driving car. Most people think it's 15 years away before we have a truly self-driving car that actually works. This stuff is too nerdy. I just got Mercedes lent me a E350 to drive up here. And it's too nerdy to use these cars. It takes 20 minutes just to figure out how to pair your Bluetooth. You know, we have to make this stuff a lot better.
Audi just drove from San Francisco.
All right, so I'm going to wrap it up. I think
there's a nerd in the car
I'll let these guys
making
keep
sure
talking
the systems are all working right.
While I wrap it up for you. Enjoy your day. Use this as a basis for what's hot, what's not in your personal journey as you listen to some of the discussions today, as you walk through the halls and see the innovations. I think we're off to the right spot.
We didn't even cover Google Glass. I mean,
whoa.
We could start a fight here.
All right, guys, thank you very much. Thank you all.